Hi everyone, I'm Maimah Karmo and I'm your host for Breathe TV, a sacred space to come to, exhale, and to breathe throughout your breast cancer journey. I'm so happy to have some amazing guests with me today. They're women who are beautiful, brown skinned, powerful, and just really amazing survivors. Before we start though, I want to create an environment for you to breathe with me before we start the show. So I want you to sit someplace that's comfortable. Just for a few minutes, close your eyes and I will guide you through a meditation to put you in a space to breathe and be embodied with us in this moment. Put your hands on your heart or on your belly, wherever you're comfortable. Say the words along with me. I embody love.
I embody love.
I embody light.
I embody light.
I embody peace.
I embody peace.
I am grounded.
I am grounded.
My breath is calm.
My breath is calm.
I am in my breath.
I am in my breath.
I am here.
I am here.
I am alive.
I am alive.
And just take 2 more deep breaths with me. One. Two. Thank you. So our guests are Karla and Tamekia. They're both, again, amazing advocates. I pray that you will hear their stories in your ears, in your minds, in your hearts, and that you will take heed of what they have to say and share. This episode's really going to be about their stories, but also focusing on endocrine therapy. Before jumping into the cancer journey, Tamekia, she's in her car. So before we get into all of what's like the breast cancer stuff, like what's happening, girlfriend?
No, I'm not home right now. I'm actually just leaving the hospital. I wasn't feeling well, but I wanted to make sure I made the meeting. So I just pulled to the side so I can join and still be present.
You know, we're here for you, whatever you need, right? Not just breast cancer stuff, but whatever you need.
Yes.
So you both have had different cancers and have therapy that was endocrine-based treatments. Karla, can you share a bit about your journey?
I was diagnosed at age 38 with invasive ductal carcinoma, HER2 negative, estrogen positive. I was living in Las Vegas at the time all alone. I moved home to Bakersfield, California with my family to start the treatment, which I did 4 rounds of chemotherapy. I had a double mastectomy. I had reconstruction, which had failed. I did 25 rounds of radiation. And then after that, I did 6 months of chemotherapy pills called Xeloda. After that, I started on tamoxifen and Lupron injections monthly. And I just finished my reconstruction November 1st of 2021. And I had the flap surgery where they took the muscle from my back and formed a breast for me. So I'm happy now. I'm living cancer free, but I still have the monthly injections and I'm still taking my medication.
So you just named about 8 different treatments and procedures. You know, for the audience, you know, you all hear a lot about people being a warrior, a badass, overcoming breast cancer and all these things, but this is what people go through. This is not a small situation. This is like you have all these things back to back to back. just to get to what you think may be the end of cancer, right? It's a lot. You mentioned having had a failed mastectomy.
Yeah, the reconstruction failed in the right breast. A month after I had the double mastectomy, it was swelling. I thought it was normal. I was going to see my surgeon a few days afterwards. I started swelling. So they drained it, and then about 2 weeks later, same thing happened again, and they said, we'll have to take this out. So they took out the right expander. And so I kept the left one in, but the right one they had to remove, and then I had to heal from that. And that took about 2 months before I could even do radiation. So I still had to wait through it all to heal.
So I know we're talking about endocrine therapy in this episode, but I think what your story is about is so important that, people think about it like, oh, my cousin or whoever, sister has breast cancer, you're going to have this first, that next, and next, then you celebrate, ring the bell, then you're done. But, you may have a surgery that may go wrong, right? And you have to do it again. You may have a treatment that may not work. Tamekia, tell the viewers about you and a bit about your diagnosis and all that.
My name is Tamekia, and my diagnosis was at 13. So at 13, I felt a lump in my breast. I wasn't sure what it was. I had discharge coming from my nipples. I had swelling in my breast, and I finally said something about it. And then that's when I went to the hospital, and they said that it was a cancerous tumor that needed to be removed. I got it removed when I turned 14, so I was still in 8th grade when I got it removed.
Tamekia found her breast cancer at 13 years old. 13 years old. Now, many people are not talking to their daughters about breast health even at 13 years old. So if you're not discussing breast health at 13 years old and you're being told to wait till you're 20-something years old to get a mammogram, you're not giving women and girls the empowerment they need to take their best breast health into their own hands. So Tamekia had breast cancer at 13. One of my other patients had breast cancer at 18, another one at 23. And so while the general consensus is that the age should be thinking about breast cancer is in your 40s, you're never too young to get breast cancer and never too young to think about talking to your daughters about their breast health, annual mammograms, and so forth. People just they never think that it can happen at that age, and it does happen. What made you look, and who did you go to say, here's a problem?
Well, what made me check was because every time I was changing my clothes, I would look at my bra anyway. And I kept noticing that I had some type of discharge. I knew it was coming from my nipple because it was still leaking, but I didn't know exactly what it was. And then it was only coming from one breast. So then when I seen it like that, I just started feeling on my breast, and then I noticed my breast was hard. So I was just like, huh. So then I felt the other breast, and the other breast was soft. Like it wasn't the same as the opposite breast. So I didn't say anything at first because I'm 13, and at that time I didn't even know anything about breast cancer. Like I knew about cancer, but not breast cancer. So I didn't say anything. I just thought that my body was going through the changes because I was going through puberty, things like that. So I just thought that was part of it. What made me actually say something was because I noticed that the lump had got bigger. So I went to my grandmother and I started asking her questions like, is my breast supposed to be hard? Am I supposed to be having something leaking from my breast? And she was like, no, why are you asking these questions? And I'm just like, because it's happening to me. And then she didn't believe me until she touched me. And then she seen the discharge coming out my nipples herself. And she was like, we have to go to the doctor. Like, this is not supposed to be happening. But even then, she didn't say breast cancer or anything like what was happening. I'm not sure if she knew herself. I'm pretty sure she probably did. She just didn't want to scare me, but she knew that it wasn't supposed to be happening. So I really do think that parents should teach their kids at all ages to check their breasts every day. Like when you're in the shower, like raise your arm and feel around your breast. Like it's just very important to pay attention and to teach your kids that no matter what age they are.
It's so true. My mom taught me breast exams at 13 because she wanted me to know how my breasts would look by looking at them in the mirror, or how they would look or feel in a shower or laying down. When you're laying down, it feels different too. So what Tamekia said was really important. It's so important to talk to your daughters about their bodies early, whether it's breast, cervical, everything. We should begin health hygiene as early as possible. When kids learn to brush their teeth, comb their hair, take their baths, of course being age appropriate, but talk about the importance of knowing your body, when to start being educated about certain things to be proactive with their health. Tell me, Karla, about endocrine therapy. How do they explain that to you? Like, what's endocrine therapy and how does it work?
I didn't necessarily find out that I was going to do endocrine therapy until the last part of my treatment plan. So when I finished my radiation, that's when that was introduced to me, that was going to come next, which would be the tamoxifen and the Lupron. I was told that with those medications, possibilities would be hot flashes would be one of the things, and emotional. You never know what may trigger that, but I've recognized now, I've been on it for 2 years. I've come to find out that I'm more emotional now, and very sensitive to just different things that I've never really been sensitive to before. I do experience aches and pains a little bit more than anyone my age, and that's because of the things that I've had to endure on this journey. My ankles sometimes ache in the morning time. That's when I feel it the worst. It's waking up and getting out the bed. That's when I'm literally at my most achiest. But when I do exercises, that helps to relieve me of that.
So at 37, 38 years old, you're living your best life. So how in the world do you discuss this with somebody you just meet? Okay, by the way, I have cancer. By the way, I'm having this treatment, endocrine treatment, and then I'm having hot flashes. I'm gonna cry for no reason. Or, my body aches. It's like, these are the realities of cancer because, we all see the pink stuff, but it's like, hello, BS. Like, this is real, right? Tamekia, share about your treatment journey. How did that work for you?
I asked, but they basically just told me my options. Like, I feel like I really didn't have that many options because of my age. Like, they put me on tamoxifen, but even when the oncologist told me that she was going to put me on tamoxifen, she explained to me what it was, and she knew for sure that it worked for older women, but she was really afraid to put me on it because of my age. At that time, I was just like, okay, like I was just saying yes to any treatment options they said because I just wanted to, I wanted to live. I wanted to beat it or whatever. So I was down for it. Although I was afraid when she told me what the side effects were, but we just had to pay really close attention to it once I started taking the tamoxifen. And the first side effect that I noticed, I had to tell her, and then we stopped it. It actually messed me up when I was taking tamoxifen. Like, it caused other problems with my health. For example, like I had blood clots, so that's why we had stopped it. And then I was like having trouble breathing, kind of like. So now I have like an inhaler that I need to use. So for me, the medicines are not working out really. I don't know if it's because of my age, but I do know for tamoxifen it's because of my age. I'm too young for it.
Do you think that it could be because that maybe sometimes they don't have enough women of color in the trials, Black women, so they can't determine how the treatments work? Because oftentimes that's been the issue, right? Because as you both know, Black women have a 40% higher death rate than white women. What do you think?
Yes, I do think that is playing a factor, and I also think what's playing a factor for me is they still don't even know what's causing my tumor exactly. They think that it's playing off my hormones, so that's what they're assuming, but they're not 100% sure. So I do feel like even now I'm basically an experiment. Like, they don't really know if it's gonna work. Like, it's basically just testing it out to see. And again, I'm still young. Most of the treatment that they have for breast cancer are for older women. Like, they don't really have anything to treat younger people except chemotherapy. But like when it comes to pills, like they don't have anything for our age.
I want to go into how you two live with this, right? Because there's a lot to live with and unpack. Are you able to talk about having menopause, reproductive challenges, or sex drives, intimacy issues? Like, how are you guys dealing with this?
I've learned to deal with it. Being at 38, I wasn't in a relationship. I didn't have any children. That was already my lifestyle. Did I want children? Absolutely. But being that I was told that I had breast cancer and that with the treatment plan that I am going to be receiving, that children would not be a part of that journey for me. Did that affect me? Absolutely, because I did want children. I thought I would get married, but that's not what my life is right now. It's so many different disparities on this road with breast cancer because, well, we should be presented all of the treatment plans that are encouraged for every culture. We all should have the same options and choices. We should be also encouraged to get a second opinion because we can't just trust the eyes of one doctor. Just because that doctor sees it, that doesn't necessarily mean that that's what it is. So we should be encouraged to get that too. Also, in regards to like me, I'm bald. There was no way for me. I didn't know anything about saving my hair, that there was a choice in that or an option. It's just so many different things that I should have known about that I did not know.
Well, me on the other hand, I'm not okay with that. So like when they were telling me that certain treatments may affect me with being able to give birth, I was not okay with that. Like because I was so young, so I'm just like, no, I definitely want to have kids, and I still want to have kids. So I do based off like certain treatments or medication. Like I do kind of base it off that because I still do want to have kids. I want to, experience being a mother and giving birth and all of that.
My daughter, I want her to have more siblings. I didn't want to be an only child. And now, I mean, we're okay with it now, but it's one thing to have a choice that you make and you say, I don't want to have children. But another thing, when something happens to your body where you just cannot, and that choice is taken from you and you're robbed of that choice. So Tamekia, did you do therapy or any kind of complementary health support stuff? Did you do that? If you did, like, how did you deal with out-of-pocket costs? Because it does cost, quite a bit to get that kind of support.
Yes, I did therapy. My doctor actually he didn't tell me that he was sending me to a therapist. He told me that it was a doctor related to cancer, but he didn't say like it was a therapist. And when I got there, she told me who she was, and I was just like, really, but I actually appreciated my doctor doing that because I thought that I was okay, but after meeting with her, I felt like it was a lot of stuff that I had kept inside of me that I finally was able to release. And not only was I able to release it, but I was releasing it to someone who understood like what I was going through. Obviously, like they educate themselves on like, our diagnosis and stuff, so they can kind of relate to it. Not because like they've been through it, but because they just, know the knowledge of it. But it still felt like I was talking to someone who's been through it versus the times when I try to talk to my friends about it and they cannot relate at all. Like they're just like, oh, you'll be fine. Like, oh girl, you're so strong. Like, or they try to tell me how I feel. So like to actually sit there and have a therapist understand exactly what I was going through and to understand what the medicine was causing with the mood swings and why I was acting this way and that way, like it really helped me. Whatever the insurance doesn't pay for it, then I come out of pocket, or like my grandmother would help me with the expenses, or like sometimes like other cancer patients that I've met, like they would give me resources of places that might volunteer and help, and my church family has helped me as well.
So we have to make it a law, some kind of policy put in place to help people with that financial, geographical barriers, mental health. Tamekia's journey is still going on in terms of her not knowing what's happening. Your journey is going on, but you have it under control in some aspect. For someone who's watching this show, they might think this is really scary. Do treatments really work? And then there are all these side effects. So one by one, can you share the importance of adherence to treatment and care, especially being a Black woman? Because we're so high risk, right? We can't afford to just say, well, we're scared and we're going to stop, or I don't feel good, I'm going to stop treatment. Why is it important to adhere? And if you're not comfortable, talk to your doctor.
I think it's important to have an advocate, a family member with you along the way. If it's not a family member, be it a best friend, somebody who loves you just like you love yourself, to be there with you, because you're not going to hear all of the things that are being told to you that are your treatment option. Another thing I would suggest is a support group. I know it's hard for us, women like us, to open up and just allow other people to share themselves with us. That's just something that we hesitate on. because it's an uncomfortable truth that we have. But a support group would definitely be wise, especially one for women of color, because we can share the experiences that we are dealing with, and we can help someone else identify something that they've been experiencing or something that they may not have recognized that they are experiencing. So, and then also we share the different things that we deal with on our treatment. So that way it'll be something that someone new to the story will be aware of. So that's another form of advocacy, and being a self-advocate for yourself. Those are the two things that I can think of. Also, if you have a voice recorder and you go to your appointments, make sure you do that, because you need to play back what's going on, because they're speaking to you and you cannot understand what they're saying. So it's best to listen to it later on when you are in your downtime. Those are some very important tips for a new beginner to the struggle.
Thank you so much. Thank you. Tamekia, your beautiful face does so much without saying a word. What is on your mind right now? Like, forget that there's cameras here. Just like, what are you thinking about?
I was thinking how, like I said earlier, how when my doctors used to tell me about like the different treatment plans, how I just used to say yes to everything because I just wanted to live. But then when like certain treatments wasn't working, or a lot of treatment wasn't working, and my tumors kept coming back, I just started to think like, am I just an experiment? And that's not a feeling that I like. Like, I don't like to feel like I'm an experiment, like they're just trying all this, all these different things on me and not really knowing like how it's going to react with me. Because like I said, when I was trying different medications, it caused other health problems. So then I started to think like, like, am I living or am I just surviving? And it's the difference between living and surviving to me. It's like, because with the problems that it caused in like other parts of my body, like my whole body is in pain sometimes, like I'm aching, sometimes it's hard to get out the bed. So with that, I feel like I'm not living, like I'm just surviving, I'm just, making it through the day. And if you think about it realistically, like living to me is like having fun and being able to go out and do whatever I want to do, my dreams or whatever the case is. But sometimes it's impossible to do that when you're in pain 24/7. And it's just like, you just have to try to push your way through to do it, but you're not really enjoying it because, you're focusing on the pain or whatever. So that's what I was, when she was talking, I was like thinking about when I was like going through that part, or like how sometimes like certain medication, like you become very depressed. And then sometimes you have suicidal thoughts and things like that. And I know for me, I have went through that like mentally, like I was, really just out of it. Like I was just tired of going through this on and off. It's just like, it's been so long, like I'm just tired of it, and I just like didn't want to be here anymore. But I knew deep down inside, like that's not really how I felt. But I do know like sometimes medications, different medications make you kind of think different as well. And, just thinking about all of that, I just really feel like when it comes to your treatment options, you should have a voice. Like, don't like let anyone pressure you into doing something that you don't want to do. And like if you are confused about something, like just really ask questions. And like she said, bring somebody with you who can ask the questions for you, because when they're talking to you, sometimes you hear what they're saying, sometimes you go completely blank, like you only heard one word. I just feel like having a support group and just being able to speak up and just educating yourself, like doing your own research and then going back to the doctor and asking questions, because they're not going to tell you everything. Like sometimes they leave it all up to us. If you don't ask, they won't tell.
People aren't often brave enough to say these things, right? People are afraid to say that they feel depressed or suicidal, because you get labeled, by people.
Yeah.
And if you're metastatic or you are going through a journey of constant recurrences and a lot of pain, I know for me, when I was diagnosed, a lot happened with the person I was with, and there was a breakup, and I was so afraid with, saying you're triple negative, we don't know what's going to happen to you. Like, my daughter kept me alive because I had to live for her. But a part of me knew that, like, I was like, I can't do this. I don't know if I want to be here. She was my North Star. If I didn't have her, I don't know. I had those thoughts, but I knew that I had to push. But I never talked about it in public before until today. So thank you for giving me the space to be able to share that for the first time.
Yeah, I just want everybody to know, like, it's okay to not be okay. Like, everyone wants to be perfect and stuff, but it's okay to not be okay. Like, we're all human. We all go through different emotions, and I mean, it's okay.
But you had a therapist, you got to move through that. So also, just because you feel depressed, you feel anxious, you feel you're having panic attacks, or you feel suicidal, you have to get help. You call a hotline, you call your doctor, you see therapists, you call a friend, you do whatever you need to do to get professional help. But there should not be a stigma on feeling anxious, depressed, having panic attacks, or suicidal because you have cancer. It just should not happen. And I really want to thank you both for sharing this, because we oftentimes go through the Wonder Woman parts of cancer and not the reality of what we don't talk about at nighttime when you're sitting there shaking in bed thinking, what's going to happen to me? And I'm so glad you both shared. I mean, Karla, your story is amazing. Your boldness is amazing. You're both bold in different ways. You're bold, you're outwardly bold, and you share, Karla. And Tamekia, you have this beautiful vulnerability that comes around you, but you're so freaking strong and badass. And I just want to thank you both again. You both gave me such beautiful gifts today. I want to just give you both a big hug right now. And I want to thank you for the gift of your spirits. I want to say, don't ever give up. Before we sign off on the episode, your niece had a message, Karla, for Tamekia. What was that message?
Yes, Tamekia, my niece is Reagan. She's 13 years old, so I told her about you. So she wanted to tell you. She said, "Hey, Tamekia, my aunt told me about you, and I just wanted to say that we're praying for you and to stay strong. I know that dealing with this is tough, but I just want to tell you that you have encouraged me to stay positive no matter what. Thank you, Tamekia." So this is from Reagan.
Thank you, Reagan. I appreciate that.
Can we just all send Reagan some feels, hugs and love? That's beautiful. Thank you, Reagan. Well, thanks, you beautiful angels. I love you both so much, and thank you for this time. And to our viewers, I think you just may have seen one of our most powerful episodes on Breed TV. There are things that you've heard that you may never have heard before, but this is why we call it Breed TV. It's a space to come to breathe, to be honest, authentic, vulnerable, and to navigate the human aspects of cancer, breast cancer, any kind of cancer really. Before we're patients, we're people first, and we're always people navigating this journey. And so please join us next time for the next episode of Breed TV. Until then, love yourself, love your loved ones, and live your life as if this is your first and last day, and manifest so many more wonderful good days. And don't forget to breathe. Love you guys so much. Thank you, and bye for now.